So I'm a doctor of physical therapy at Alliance Physical Therapy. I mostly deal in orthopedics, but I also treat people with neurologic conditions, dizziness and vestibular conditions, and pelvic floor physical therapy. And a lot of what I see is people who have been in pain for a long time and are sort of at their wits' end. They've been dealing with either the same recurring issue or maybe multiple issues that have been giving them problems with their daily activities and the things that they enjoy doing. So what I'll be talking about with you today is a conversation that I have with a lot of my patients who are experiencing these kinds of symptoms, and it's how to manage your chronic pain and how you're in charge of your nervous system and strategies to help with that. So give me a second here while I share my screen.
You're muted, Dr. Shields.
Can you hear me now?
Yes.
Okay, that's interesting. When I went to share my screen, it muted me. Let me try again. Can everybody hear me?
Yes. Yeah.
Okay. All right. So a little bit of background on chronic pain and its prevalence in our society. So you or somebody that you know probably experiences chronic pain because it's really common. 1 in 5 people in the United States experience chronic pain, and over a third of those people who are experiencing persistent pain report it being high impact. So it either limits their recreation, their occupation, or the daily activities that they like to do. Low back pain is sort of the heavy hitter for this one. It's one of the most costly conditions in the US in terms of testing, treatment, preventions, surgery, all of the things that people try to throw at low back pain to try to get it to calm down. And then if you start to throw in any sort of arthritic pain, musculoskeletal pain, sciatica, that cost and time of managing painful conditions starts to really get pretty big. So when we're dealing with chronic pain, we think of it as something called a terrible triad. So you're experiencing pain, which can be really frustrating and depressing, really. It doesn't allow you to do the things that you like to do. So that pain causes depression. That depression can often lead to lack of sleep. So either you're unable to fall asleep at night or you're waking up throughout the night because of the pain. And because you're tired and irritable, it makes you more depressed. Because you're more depressed, you feel that you're in more pain, and that cycle starts to just feed into itself. So our goal with managing chronic pain is to try to find a way to break that cycle and stop the feeding of those 3 factors into each other to try to find a way to better manage the symptoms. So science is changing all the time, and I think it's really helpful to look at how we've viewed pain historically to understand where we are now and to have an idea of what the best evidence shows on how to handle pain. So if we go all the way back to as early as the 1940s, people were getting frontal lobotomies for psychiatric disorders. There was heroin and cough syrups. We've learned in just 80 years or so time that the things that were best practiced then are not necessarily practiced now. And the same goes to show for anything orthopedic or related to pain. So back in the ancient Greeks, 300 BC, Aristotle thought that pain was related to evil spirits entering the body. So the gods would enter the body during an injury, and if that injury got so bad, then it would completely end you. And when they would look in cadavers of people who had passed away, they weren't really worried about the brain, didn't really have and it didn't see any connection between the brain and pain. They were more focused on the heart and the liver. And if they found any issues, pathologies with the heart and liver, they'd go, okay, there was the source of their pain. Big jump forward to the 1600s, Rene Descartes, his model was more based on the tissues. So his idea was that pain is a stimulus created by the tissues at the origin of the pain. And then the tissues would then send that message to the brain, and the brain would interpret it as painful. So with his model, if you dropped a 10-pound bowling ball on your foot, it's going to feel like a 10-pound bowling ball hit your foot. So the tissues respond to the stress that they are put under. They send a message to the brain, and the brain interprets it as 10 pounds of pain. If you were to drop a 100-pound bowling ball or probably something else on your foot, the tissues would interpret that as 100 pounds of pain, send the message to the brain, and you would feel 100 pounds of pain. And this seemed pretty solid for a while. It seemed to make sense that the tissue is affected, you feel the result of it. But the cracks started to show where if you had a cortisone injection, a nerve block, an epidural to a painful area, some people got complete relief with their pain, but other people didn't. So how if you were addressing the tissues that are injured with analgesic and pain relieving techniques, why wouldn't that completely eliminate the pain? So they had to start expanding upon this theory of where pain comes from because it didn't quite account for those cases. So then in 1965, a group of researchers came up with the gate theory of pain. So in this theory, your spinal cord acts as the gate of all the messages that go to your brain. So you've got nerves in your tissues, in your arms and your legs, everywhere apart from your spinal cord. Those nerves then go to the spinal cord, are interpreted there, and the final message is sent to the brain. And whatever that final message is that gets to the brain, that was what you would feel. So you have pain receptors, you have pressure receptors, you have temperature receptors in your entire body. Those are all different nerves that sense those things. So depending on the stimulus, 1, 2, or all 3 of those can be stimulated. So in this same 10-pound bowling ball situation, if you dropped a 10-pound bowling ball on your foot, your pain receptors or your nociceptors would send that signal to the spinal cord. If it was a high enough stimulus, the spinal cord would send the message to the brain and let them know that there was pain in that area. Now, we've probably all stubbed our toe at some point, and most people, when they stub their toe, their first instinct is to grab their foot and start massaging it or adding pressure to it. By doing that, you are stimulating your pressure receptors. And then the theory with the theory behind the gate theory of pain is that if we can override that signal at the gate, if you have a pain signal going to the spinal cord and you try to cover it up with more of a pressure signal or a temperature signal, then that message can get a little bit mixed up at the spinal cord, and the pain message sent to the brain won't be as severe. So that gate measures whether the stimulus of the pain or the stimulus of the pressure is higher, and whichever one wins out is the message that goes to the brain. So this made a lot of sense too. When people are injured, if you fall on your knee, the first thing you do is grab your knee. And we know that adding pressure, adding touch or heat to an area feels pretty darn good. And this is where the idea behind e-stim units or TENS came from. So if you're not familiar with these, TENS units are used with a couple electrical pads that you put over the site of pain on your body. You run a light electrical current through it, and it essentially sends like a tingly sensation to the skin and to the brain. So a lot of people, when they're feeling pain, you can put a TENS unit on that area, turn up the intensity of the electricity, and it can actually make that pain feel a whole lot better. And again, similar to the Cartesian model, for a lot of people, TENS units, heat, compression, massage did a really, really good job of eliminating pain, but there was still a subset of people where that was not the end-all be-all, and it did not completely relieve the symptoms. So then our final stop on this timeline is the 2000s and beyond. And this is where researchers have developed something called the neuromatrix model, or the biopsychosocial model of pain. So This is the visual representation of the biopsychosocial model of pain. And you can see that there are a ton of factors that contribute to pain and quality of life in the middle there. So I'm going to zoom in so that we can really get a good look at this. So you've got all of your outcomes, the things that we care about in the middle, our pain, our quality of life, our ability to walk, our ability to stand, our ability to do the things that we want to do. And there are factors from a lot of different regions that impact all of those areas. It's not just the tissue, there's a lot more going on here. So there are individual factors up there at the top in yellow. So your age, your BMI, your genetics that contribute to your pain and your quality of life. There's psychological factors such as anxiety, stress, any unpleasant memories associated with the pain or prior to the pain or even at the same time as the pain. There are biomechanical factors, so your strength, your balance, your flexibility, how you walk, if you have any structural changes like a scoliosis. There's nociceptor detection or pain receptor detection, where between person to person, that 10-pound bowling ball force can feel very different. So some people have nerves that are very, very sensitive. Other people have nerves that are less sensitive. And that's something that's well documented, that people's resting level of nerve activity can be very, very different person to person. There's also tissue damage or injury. So if you have degenerative disc disease or joint disease, if you have musculoskeletal pain, a tendinous pain, any sort of cell damage, that would be the actual pathology that maybe precipitates the pain or coincides with the pain. There are behavioral and lifestyle factors. So depending on your occupation or what you spend most of your day doing, is it a repetitive motion such as repetitive lifting or hammering, or is it a pretty sedentary lifestyle where you're working at a desk most of the day? And then what does your life look like outside of those working hours? Is it pretty active or more on the sedentary side? Those can all affect those perceptions of quality life and pain in our brain. There's also contextual factors. So is this an area that you've injured a few times? Is this an area that you've always been a little bit sensitive about? Or is it, was there an unpleasant situation surrounding when the pain happened? And then finally, there's the social and work factors. So home and work stressors, your financial stability, whether you're on disability, anything that contributes to the stress of managing this condition. So again, super complex in terms of all the factors that can contribute to what the pain is perceived as with our nervous system. I want to share a video with you guys that I think sums this up a lot better than I can, and gives you some visual feedback too. So I'm going to pull that up here. Corey, I will start the video and I'll pause it to make sure that the audio is coming through to you guys. As long as it is, then we will keep on.
Okay, sounds good.
Everyone agrees that pain is a universal human experience.
Can you hear that?
Yes, we could hear it, but not see it, I think. Yeah.
Okay, let me probably need to switch which screen I'm sharing.
And when I've done this in the past, there's normally a button about sharing audio, I think. But I think you probably have that, so.
I do have that clicked. Can you see the video now?
Yes.
Okay. All right, I'm gonna hit play. If you can't hear it, stop me.
Okay.
We know that pain is 100% of the time produced by the brain. Everyone agrees that pain is a universal human experience. We now know that pain is 100% of the time produced by the brain. This includes all pain, no matter how it feels, sharp, dull, strong or mild, and no matter how long you've had it. You might have had it for a few weeks or months. This is called acute pain, and it's common with tissue damage, say from a back injury or ankle sprain. And generally, you'll be encouraged to stay active and gradually get back to doing all your normal things, including work Or you might have had it for 3 months or more, and this pain is generally called persistent or chronic because in this type of pain, tissue damage is not the main issue. What's less clear, though, is when you're told you have chronic pain, is knowing what's best to do about it. Well, in Australia, chronic pain is a really big problem. In fact, 1 in 5 people have it. Having a brain that keeps on producing pain, even after the body tissues are restored and out of danger, is no fun. Some people say it still feels like they must have something wrong. But that's just it. Once anything dangerous is ruled out, health professionals can explain that most things in the body are healed as well as they can be by 3 to 6 months. So ongoing pain being produced by the brain is less about structural changes in the body and more about the sensitivity of the nervous system. In other words, it's more complex. So to try and figure out what's going on, you need to retrain the brain and nervous system. To do this, it's helpful to look at all the things that affect the nervous system and maybe contributing to your individual pain experience. What can help is to look at persistent pain from a broad perspective, and by using a structured approach and a plan, it's less likely that anything important will be missed. Let's start with the medical side. Firstly, taking medication can help, but only to a limited extent. It is the more active approaches that are necessary to retrain the brain. So using medications to get going is okay, and then mostly they can be tapered and ceased. Some people also think surgery might be the answer, but when it comes to a complex problem like chronic pain, surgery may not be helpful. So if you're thinking of surgery, it's better to get a second opinion and remember to consider all the things. Next, it is helpful to consider how your thoughts and emotions are affecting your nervous system. Pain really impacts on people's lives, and this can have a big effect on your mood and stress levels. All those thoughts and beliefs are brain impulses too, but you can learn ways to reduce stress and wind down the nervous system. This helps with emotional well-being and can reduce pain as well. The third area to consider is the role of diet and lifestyle. Now, it turns out that our modern lifestyle might not be so good for us. In fact, what we eat and how we live may really be contributing to a sensitized nervous system. Looking at all the things like smoking, nutrition, alcohol, and activity levels, and seeing if there are any issues is a good beginning. And these things can go in your plan. Then there's often enormous value in exploring the deeper meaning of pain and the surrounding personal story by stepping back and looking at all the things that were happening around the time the pain developed. Many people with pain can make useful links between a worrying period of life and a worsening pain picture. For many, recognizing deeper emotions can be part of the healing process. Last, but by no means least, is physical activity and function. From the brain's perspective, getting moving at comfortable levels without fear and where the brain does not protect by pain is best, and you'll gradually restore your body's tissues. So, to sum up, pain, it comes from the brain and it can be retrained, and when looked at from a whole person or broad perspective, gives you a lot of opportunities to begin. So, get a helping hand if you need it, set a goal, and begin.
All right, so I think they do an awesome job in that video of really showing all of the factors that are helpful versus hurtful for our nervous system, but I want to dive into it a little deeper with you guys today. So I'm going to share my screen once more here. All right. So big takeaways from that video. So looking back at the pain through the ages that we were talking about earlier, pain is not from the tissues. Pain is now confirmed to be from the brain, and your brain is deciding how intense or how frequently you are feeling this pain based on a whole lot of factors. It is not just the state of the tissues. It is taking into account your past experiences, your current emotional state, your sleep, hydration, your nutrition, all of the things that have a huge impact on how our nerves are firing has an impact on how our brain perceives the pain. So takeaway number one here, the pain is produced by our nervous system or our alarm system. And really the purpose of pain is not to alert us that there's been an injury to the area. While it does that, it also is a way of being sort of a flag to be like, hey, you should bring your attention to this area. I think there might be a problem. But our alarm system can get a little bit overly sensitive and be telling us that there are problems when there are either resolved problems or nothing at all. Takeaway number two, pain that has been felt for more than 3 to 6 months likely isn't due to damaged tissue anymore. I see a lot of people who have been having persistent pain and that anytime they move, that pain is their disc re-rupturing or an aggravation of their meniscus tear. And realistically, there is no more damage happening at that point. Your nerves in that area are still very sensitive to movement, but they are being overly cautious and they are preventing you from moving because they are being cautious. And the farther we get away from that original injury, the murkier that relationship between the tissue health and the actual pain becomes. Takeaway number three, if I haven't made this clear enough already, pain is affected by a lot of factors. Number four, your pain is always real. So I've been talking a lot about how the pain comes from your brain. That does not mean that the pain isn't real. It is very real. But the mechanism that produces the pain, again, can become overly sensitive and protective. And then number five, if we can make our alarm system less sensitive, we can move more with less pain. So that's where getting a multifocal approach can become really, really helpful. So I like this diagram here because it sort of shows what myself in the video described about the excitement level of our nerves. So whether we are sitting watching TV, running a marathon, or sleeping, we always have a normal level of activity in our nerves. So in this first picture here, there's this resting level that oscillates throughout the day of how many signals or how many messages your nerves are sending out. And depending on what you're doing, that level of nerve excitation can increase or decrease. So if you're running a marathon, you're probably going to be at the higher level of nerve excitation compared to when you are sitting on the couch watching a movie. But because the level of nerve firing that happens throughout a day is so far away from the firing level up here, the firing level being the point where it sends a message to the brain saying, red alert, danger, is painful, it allows you to do quite a lot before you get to that level of pain. However, after you've experienced persistent pain or while you're experiencing persistent pain, that normal firing level hangs out at a higher level. So there are more signals going off, they are easily set off, and it's happening a lot more frequently. And you can see when it's firing at this higher level, it leaves a lot less room for activities before you get to the firing level of pain. So our goal with an approach that includes all sorts of things from this list is to try to get that resting level of nerve firing to go down and down and down over time so that you get more space for nerve activity between your normal rest level and that firing level for pain. So this is not a comprehensive list of all of the things that can be involved in it, but it hits a lot of the big heavy hitters for managing pain. So let's walk through those together. Oh, if it'll let me scroll. There we go. Okay, so this is going to be a multifocal approach, and I want to emphasize there is not a one-size-fits-all solution for anybody's pain because everybody's a unique individual. Your experiences, your symptoms, your stressors, your environmental factors are all going to be different, so it's going to be a different recipe for everyone. But that's how it sort of becomes unique to you, and you can sort of work through the areas that you think are maybe larger portions of your pain profile or lesser versions. So the first step here in approaching how to manage our persistent pain is finding a really good source for emotional and psychological support. So like I myself in the video mentioned earlier, stress, anxiety, depression plays a huge role in that firing level of your nerves and can get them into an already more sensitive state. So there's a lot of different approaches that you can take here to try to get your body out of the sort of fight or flight mode and more into the rest and digest mode to help get your nervous system a little less sensitive. So that can involve talk therapy, stress management techniques like mindfulness, meditation, breathing strategies, having something like an activity that you really enjoy to do that helps calm yourself down, whether that is reading a book, listening to your favorite music, doing some deep breathing, doing some yoga, and really trying to get your brain more into that rest and digest phase. The other really important part of this, which we're all working on here today, is learning about pain science. So what we found with research is that one of the most crucial steps of being able to get a handle on the pain is understanding where the pain is coming from and having a really, really good understanding that there is not one perfect solution for everyone. So everybody's probably heard somebody's success story about how they tried XYZ and it completely eliminated their pain, whether it's chiropractic, acupuncture, physical therapy, or a certain medication. Maybe it worked perfectly for that person, but that is no guarantee that it's going to work perfectly for you or for any of us here. So if we can get a really good understanding that pain is individualized and that it is an alarm system rather than tissue damage, that opens up a world of possibilities to us. Second big one, which is also a heavy hitter, is finding ways to move more. Because like the video said, movement is going to be the thing that actually helps to get your tolerance to activities back up. It doesn't matter if you have the best medication in the world. If your goal is to be walking half an hour a day without pain and you are only treating it with taking prescription strength anti-inflammatories, you're not going to be able to walk 30 minutes without pain if you haven't been practicing it already. So the approach that I take in my practice and that a lot of physical therapists do is a combination of educating patients on this pain neuroscience and something called motor control training. So motor control training is taking a look at the individual in front of you and finding what movements or what activities are the most exacerbating of their pain and finding little ways to start exposing the body to it and getting it more comfortable with those movements. So for example, let's take the situation where you had disc herniation and it was really, really painful. You managed it conservatively for a while and it got to a more manageable level, but it never went away. And it was constant. Maybe it flares from time to time and you can't bend over, you can't lift anything up without that pain in your back or down your leg going off. So the way that we approach this with motor control training is, okay, so maybe the most painful movement for your back is bending forward and trying to pick something up off the ground. We're not going to start with just doing that 50 times because that's going to get all the alarm bells going off in your nervous system. But maybe we start with sitting in a chair in a more supported position and doing some rocking forward or rocking to pick something up from a stool in front of us. So not completely leaning forward, but just bending forward at the waist and sitting. Maybe we do some cat-cows or some arching and sagging of your back to, again, expose your back to that movement without getting into the full loaded movement that you do when you're bending and pick something up off the floor. And then we continue to progress that over time with either more load, more difficulty, until we get to the point where your brain is now accustomed to doing this movement without any alarm bells going off. So it's taking a graded approach over time and working at the pace that your body tolerates to find that level of activity that's doable and then try to build a little bit more into it every day. And the key here is that even if bending forward and picking something off the ground is the most painful thing for your back, even just sitting and rocking in the chair is probably going to give you a little bit of discomfort. But knowing that that is not causing tissue damage and not causing injury is the key to helping retrain your brain to know, okay, I'm moving in spite of the pain, I'm not causing tissue damage, and tomorrow or a week from now, I'm going to be able to do a little bit more of this. And the goal with this combination of pain science education and motor control training is to try to improve that functional capacity of what you can tolerate before the bells go off. Another big part of the movement category is aerobic exercise. So the research on aerobic exercise shows us that while you're temporarily more in that fight or flight zone of your nervous system when you were running, when you were biking, or when you were walking, afterwards, between the endorphin release and the just overall cardiovascular effect that you have, you actually go into a really nice level of rest and digest and more of a calmed nervous system state. So it's really good for both the cardiovascular benefits and just keeping your activity levels up, even if some activities are painful, and helping to get your nervous system calm down a little bit. And again, key with that is finding something that is doable, enjoyable, and ideally feels maybe a little bit sore, but not super painful at the end. So finding that level of difficult but doable and feels good afterwards. Another sort of caveat that I want to throw in here, because everything is so individualized, trying to use some of these strategies to get yourself moving can be really difficult to navigate. Well, maybe I had this injury a few months ago and it seems like it's getting kind of persistent, but I don't know, I haven't seen a doctor in a while, or I haven't had it checked out. Seeing your orthopedist or seeing your physical therapist or primary care doctor to help rule out whether there is anything pathological going on can be a really important step here to make sure that you're proceeding on the right path and we're treating that should be treated. Because if you tripped and hurt your knee and 2 weeks later start trying to do this graded approach of moving despite pain, but you have an actual ligament tear, that could be problematic. So checking in with a trusted clinician can be a really good first step here if you feel that that could be relevant to you. Moving on to step 3 here, thinking about lifestyle changes. So things that are really important for nerves is that they are given good, healthy circulation with your blood, they get adequate time to rest, and that they have lots of fluid and movement. So big heavy hitters in your lifestyle that affect this are sleep, hydration, and nutrition. So sleep, when people say that 8 hours a day is what you need, it is not a number out of a hat. What study shows that people who get 8 hours of sleep versus people who get 7 hours or less is that cognitive performance significantly declines after under 7 hours or under 7.5 hours, I believe it is. Cognitive performance declines, mood is less stable, nerve firing is increased and more sensitive, and thus you are more susceptible to feeling pain at lower levels of activity. So making sure that you are getting adequate sleep to allow your nervous system to fully recover in between days is really key to trying to get that firing level of your nerves to get a little bit lower. Some important things to keep in mind for hygiene or things that help with falling asleep a little bit more consistently is a cool, dark room, avoiding screen use before bed, which I am a huge culprit of, but I also recognize that if I get a bad night's sleep and I'm feeling a little bit more discomfort the next day, that I know where to point at. And also trying to set a good sleep schedule. So if you're going to bed 1 at 2, it's going to be really hard to maintain that consistent 8 hours of sleep. So trying to go to bed and wake up at the same time every day can be really key for trying to create that sleep routine. Next up, hydration. So the recommendation in research is to drink half of your body weight in ounces of clear water per day. So if you weigh 200 pounds, you're drinking 100 ounces of water. If you weigh 150 pounds, you're drinking 75 ounces of clear water. And I say specifically clear water because your coffee, your tea, your chocolate does not count into this total amount of fluids per day. You can absolutely still have those, they just don't count towards the total level of hydration that you're trying to get in terms of ounces. Nutrition, a balanced diet is super important to making sure that the nutrients that do get to your nerves are not nutrients that aggravate the nerves. So biggest things in research that are inflammatory towards nerves are sugars and artificial sweeteners and alcohol. So those are the big heavy hitters that I'll often have people with chronic pain, and they find that if they start to cut out artificial sweeteners, all of a sudden their pain is a very different quality, or their sensitivity to motion is not what it used to be. So big hitters there, and seeing a nutritionist can be really helpful for this, just to find ways to make it the most doable for your lifestyle. Because I know for myself, like, sugars and sweets are my kryptonite. So that's not something that I can remove immediately, but if I've seen a nutritionist before to give me some sort of how I can best structure my meals so that I'm making sure that I'm getting all of the important food groups that I need and keeping those inflammatory foods in moderation without getting a lot of cravings for them. Another thing that I would be remiss not to mention too is smoking. So apart from all of the dozens of pathologies and issues that can come from smoking, the biggest one for nerves is that when you put and that nicotine hits your bloodstream, it does something called vasoconstriction to your blood vessels. So the blood vessels actually narrow and don't allow as much blood to be passing through. And as I mentioned earlier, one of the key things that your nerves need to flourish and to be healthy is a really good, healthy blood supply. So if you are chronically cutting back on that blood supply throughout the day, it's going to be really hard to get that nerve to be less sensitive, because it's operating on half empty. It's not getting all the gas that it needs. Number 4 is physical modalities. So looking back to the earlier pain science ideas, we do know that physical modalities can help to stimulate those other nerve fibers and give you some relief to the pain. So whether that's heat, ice, e-stim or TENS, compression, massage, whatever for you is going to be the ticket for you. A lot of people ask me, should I use ice or heat? And my answer is always the same. The only time that you don't really want to use heat is if you have an area that is swollen, because it's going to bring more blood flow to the area and potentially more swollen. In 99% of other situations, you can really use either. So if you have a painful shoulder or a painful back, and somebody told you that you should only ever use ice on it, but you hate how ice feels, use heat. Heat is going to be much more effective for you than trying to just use ice, because heat can worsen inflammation. The research out there shows that heat does not worsen inflammation. The only thing that it can worsen is swelling. Number 5, which again is, I would be remiss not to mention, medication management can definitely be key for a lot of people to sort of knock back a little bit of level of the pain so that you can start to implement some of these practices. Because if your pain is to a level where you cannot even manage to get yourself through the day or to make any lasting changes, then you need something to be able to take the edge off. So whether that's pain medication, muscle relaxants, or even antidepressants that influence your serotonin or that happy chemical in your brain, have been shown to help decrease that constant nerve firing or that overactivity of your nervous system and allow you to bring your nervous system down into a calmer level. And then with all of these ideas, all of these crucial steps that can be important in tackling your individualized persistent pain, making sure that you have a plan to address it is key as well. So I like this acronym of SMART goals. So you want a goal to be specific, measurable, attainable, relevant, and time-based. So if your goal is to walk more or walk without pain, set an actual time. Maybe you want to be able to walk 15 minutes with your dog without pain. That's the specific. You want to walk this far with no pain. Measurable assets is the next part. So how are you going to address this? Are you going to walk 1 minute more every day or 1 minute more every week? Are you trying to walk every day or every other day? Set an actual timeline for how you want to approach this so that it's not just, well, today I guess I'll see what I can do. Attainable. So if you haven't been able to walk through the grocery store without pain in 2 years, make your goal to walk a 10-miler by the end of the year. Make it something that is attainable and doable for you to achieve in a specific time period. Relevant is going to be the next one. So if you want to work on walking, if you are not working on walking, then it's probably not going to be a relevant way to address that goal. and then time-based. So you want to accomplish this in 2 weeks, 2 months, 2 years. Give yourself a timeline so that you are able to set measurable checkpoints along the way to see how you're doing and to see if anything needs to be switched up. So those are all of sort of the key areas to be addressed when managing persistent pain. But there's tons and tons of resources out there that can talk about more that you can do in each of these domains if you think that one could be one of the big drivers for your pain. And I like to think of pain as sort of like a pie chart. So rather than the big messy map that I showed earlier, thinking of like, okay, well, I know that I know for a fact that I never get 8 hours of sleep. That's probably a big slice of the pie here. I don't drink much water, and I also have been smoking when I'm stressed. That starts to fill in all pie pieces. And if any of you are familiar with any of the Dave Ramsey financial lectures. I remember learning about them when I was younger and in high school. He always says, like, use the snowball effect. So pick the smallest one and start to address that and get the snowball rolling so that you can start to address the bigger ones. So if you've been smoking for 50 years, but your diet has been only a little off for the past few months, I'd probably tackle the one that is the smallest slice of the pie for you, or the most to get the ball rolling, and then start tackling some of the other ones. What I did include here at the bottom of this handout, which Corey will have access to give to any of you interested, are some other helpful resources that I will give to patients a lot. So the first one is a website called tamethebeast.org. It is a website that was developed by one of the leading professors and researchers in pain science named Laura Mosley. And he has a lot of helpful blogs and information and even some email listings that can help you just sort of stay on track with your goals. Pain.com has a lot of metaphors and ways to better understand pain. One that I want to mention too is when we're trying to address these persistent pains, like I said before, understanding where pain comes from and why it happens is really, really key. And the metaphors I use tonight may not be metaphors that click for you or really resonate with you. So hearing it a couple different ways or in different words and different metaphors can be really helpful for having it all sort of sink in. I know that when I was learning this, I had to watch probably half a dozen different videos until it really started to click for me what pain is and how the brain is really the driving force behind it. And then the last link starts to get into it a little bit more specifically by body parts. And it'll talk about sort of the relevance of a lot of different medical or conservative interventions by body parts. So if you've ever had somebody tell you to use like a PRP injection or acupuncture or chiropractic, it'll dive into the research and sort of the efficacy of any of those things on the area that you were dealing with, which be really helpful to sort of navigate all of your options out there, because it shows you what best are and what the ones that so are. Some apps and websites that I really like for stress management and trying to build in that sort of rest and digest, quieting the nervous system are Calm, Insight Timer, Headspace, and Curable. I know that they're all in app form, and I believe a few of them are also available online. And there are YouTube videos as well, whatever works for you. I have no doubt that Monroeville Library probably has stuff available on ways to improve your mindfulness or stress management or breath work. And then I included a few more videos here at the bottom that explain similar to how the video I showed you at the beginning did, but with different examples and different analogies that I think are really helpful for seeing this in a couple different lights. So that is what I have for you guys today. I'm really passionate about this, and it is a constant learning experience for me and for the clients that I work with. So if you have any questions, I would love to hear them and talk through them together.
Absolutely. Thank you so much, Dr. Shields. If anybody in the room has questions, I'll repeat them for you just to make sure that they're clear. And if you have questions on through Zoom, you can either put them in the chat or you can unmute yourself to ask that question.
I have a question in regards to nerve pain
Okay.
due to inflammation.
So you have a question about nerve pain due to inflammation.
Right. In particular, what I'm experiencing, what I've been diagnosed with, is tarsal tunnel bilaterally in my feet. And they told me it was due to inflammation. And there's not much that I can do about it.
Okay, so you have tarsal tunnel that you experience bilaterally in your feet, and they've told you it's due to inflammation, and it's something you can't do much about. Is that correct?
Right. And I'd like to know if she knows anything that I can try. I mean, I try to stay away from foods that cause inflammation, like some of your nightshade vegetables, like potatoes, eggplant.
Right.
To the top of my head.
Oh, but you're curious if she has any other suggestions besides the ones you worked on diet. Were you able to hear all that, Dr. Shields?
I'm pretty sure I caught most of it. Yeah. So if I don't answer your full question, please fill in the blanks. But with tarsal tunnel and more of like an inflammatory condition like that, it's definitely still in the realm of this persistent pain. So making sure that you're sort of ticking through those boxes and seeing like, all right, I did address condition, but that doesn't seem to have covered everything. What else could be contributing to this? That would be definitely a place to start. And then the one other thing that's really important for painful nerves, so slightly different than nerves that are just firing too much. If we have a nerve that is painful, experiencing inflammation, it needs three big things in order for it to be most happy. It needs the blood supply that I mentioned. It needs to be able to move, so it needs to be able to glide back and forth, sort of like spaghetti, and then it needs space. So if it's being compressed by any tight muscles, tight ligaments, tight tissues, tight shoes even, those can impact the space that the nerve is actually moving through. So if you've seen, I'm not sure if you've seen a physical therapist or any rehab professionals for this before, but probably an examination to see if there are any other areas that are contributing to the inflammation or compression in that area, apart from any of those chronic persistent pain factors would potentially be helpful for you. Okay. Did that answer the whole question?
You think that was good? Okay, yeah, I think that covered that one. Any other questions from the room? And if you haven't used the chat function yet, I'm just putting a brief hello in there.
I'm going to get a copy of this presentation.
Yes, well, the video itself will go onto our YouTube and Facebook pages, and then we have the handout that I can print out for you tonight or send to you by email. Any other questions that anybody would like to cover?
Where does arthritis come in?
Okay, so I think there was some interest from the whole room for the question, where does arthritis come into this?
Yes, so if we go back to that crazy colorful map that I showed you, arthritis would fit into that category of like a tissue pathology that contributes to the pain. So there is change to the cartilage at the end of the bones that creates friction and discomfort between the joint. So that is a true pathology that is contributing to the symptoms. And there are definitely a lot of strategies for arthritis, and more than I could cover in an entire day. But key ones are definitely management, specific movement, so making sure that you're maintaining the full motion of the joint as much as you can, which there are think of the quickest way for resources like that. I used to have a goal that I would refer to people, but I might have to check back in to see where those are. But maintaining the full motion of the joint and making sure that the muscles and ligaments that cross the joint are strong and flexible are key to keeping sort of the biomechanical factors under control. And then all of the other elements still with persistent pain are included as well. And I see a lot of people with arthritis where on days when they are more sleep deprived or haven't had much to drink, their symptoms are usually in a heightened state, because even though there is a pathology that's happening between the bones, there is that arthritic change. There are still nerves in that area that detect sensations. So there's absolutely an opportunity to get those nerves in the area to be a little less responsive to activity, even in the presence of arthritis.
All right, thank you very much.
So can I ask one question?
Sure, go right ahead.
Yeah, so I drink water only when I'm thirsty. And you think is it necessary to make conscious effort to drink in addition?
Yes. So actually, when we get the sensation of being thirsty, that is our brain's like last ditch option of trying to convince us to drink more. So if you're only drinking when you're thirsty, you are getting the bare minimum that your body needs to be successful. So yeah, to answer your question, yeah, unfortunately, just drinking when you're thirsty is not enough. The amount of fluid that our body needs to be successful is a lot more than your brain is going to tell you to drink.
Thank you.
Yeah, you're welcome.
That's always a question I have, so I'm glad that someone asked it. Okay, any other? Oh, yes, we do.
I have one. I mean, and I know this might speak by me, but what's the explanation of when, besides old age, where you have pain everywhere, like today in your knee, but tomorrow in your hip, the day after that in your arm, the day after that in your other arm, and it just keeps going around and around and around.
Were you able to hear that
Yes.
all clearly?
Yes, I've definitely seen that before, where I have somebody who comes in for their knee, and the next time I'm in, they're like, neck's been bothering me, and the next time they're like, yeah, neck's feeling better, now it's the hip. So super common for that to happen as well. And it's not just age. We know that our bodies change as we age, but that doesn't mean that we are all doomed to be in pain all the time. When that pain is moving around, it immediately sets off the alarm bells in my head that like, all right, we've probably got a nervous system that is like ready to fire on a couple different areas. So it's not just the knee nerves that are more sensitive or shoulder nerves. Everything in the system is a little bit heightened. And a lot of sort of the biomechanics or the way that you're getting around or moving around throughout the day can cause that bounce effect. So if one day your right knee is bothering you, so you sort of favor that knee when you're walking, and then the next day your left hip hurts, that's definitely something that I see as well, where it's sort of that compounding effect of maybe there's some pathologies going on in these areas on top of a nerve that's aggravated, and then the way that we are moving around throughout the day or catering to those areas can sort of feed into what areas nerves are yelling the loudest that day.
Well,
You're muted right now, Corey.
Yes, so we should be good.
Okay. The weather. When damp or going to rain, you know, when I was young, I would laugh at older people who would say, oh yeah, it's gonna rain because this is hurting. I thought that was the funniest thing ever. However, now that I am there, it's true. That does happen. up with that?
It- I'm so glad that somebody asked this, because this is something that I've seen in my clinical experience a ton. Whenever it's a rainy, muggy day, everybody comes in and their pain is worse. And until legitimately about 2 months ago, I did not have a good science-based explanation why. But I actually attended a pain conference a few months ago, and what they're finding is that your individual nerves, they're sort of like the start end and the finish end, and then there's a little fatty wrapping around it called a myelin sheath. And that fatty wrapping helps to make the nerve impulse go from one end to the other. And sort of at the start end, you have like receptors that take any sort of signals from the environment and sends the message to the finishing end. So the finishing end only gets the message that's sent from the front end. What happens as we age or after injury is that instead of just the front end responding to areas in the environment, the actual fatty lining of nerves can sort of break away and change as we age, and new receptor sites can show up on the long part of the nerve. So you can get receptors on the nerve that are sensitive to temperature, pressure, so a person comes in with weather, those are all can be detected by those new nerve receptors and then send a message down the remainder of the nerve. And this is something that we don't have a good solution for yet, and we know that it happens, and we know that on those days it's probably best to not do your most activity on that day, because if you've already got a little bit more pain and then you pile on all of the chores that you have for the week, it's probably going to be too much for your nervous system. But there are a couple pharmaceutical companies that are actually studying to see if we create medications that can block the receptors on the long part of the nerve that are sensitive to pressure and weather. So yeah, super interesting research that we're finding that there is an actual scientific explanation behind why why people feel it, and that it's not just like something that everybody over the age of 50 agrees to like start telling everybody without any actual cause. Like there's a real reason why this happens, and a lot of medical companies are trying to find a way to block those receptors.
Awesome. Thank you.
Yeah, you're welcome. I'm so glad you asked.
Medical marijuana, is it, what is it playing? That's a good question.
Yeah, no,
Is it?
we get more and more questions about
Does
that
it
here.
help? Does it hinder? Does it help temporarily and then mess you up the rest of the time? Does it do?
We-
10 months now, I haven't got it. It scares me.
Were you able to hear that, or should I repeat some of it?
I think what I heard was, does it help temporarily and then mess you up for the rest of the time?
That was a big part.
Was that the question?
Okay.
Okay. Was there something else too?
Well, she was saying she has a prescription from a pain doctor. She hasn't used it yet because she's concerned about how effective it would be and other impacts that it would have. Is that
pretty
correct?
much full of arthritis and lower back pain, spinal stenosis and arthritis.
So for arthritis and spinal stenosis, is that an effective pain relief method? I would say was the question. Was that
Yes.
good?
Yes. Is it just a temporary help and then follows you up with your conditioning and whatever when you're trying to set up your body to appease the pain, and does the marijuana with that kind of screw up the works?
Yeah, I have kind of a add-on question to that. I mean, does it fall in the same category as, what you were saying about pain medication, whether it's over the counter or prescription, that it's something you start off with and wean, or is it something that can be a more long-term solution?
It can really fit into either category. Oh, sorry. I think I missed the end of the question.
I was just going to say, I realize this may not be entirely your field, but if you could give us any insight.
So I'm not a prescriber of medical marijuana, but I certainly see a lot of people who do have prescriptions for it. So yeah, very much still in my field too. I think that it can definitely fit into either category of sort of the long-term management versus medication that could potentially be weaned. So the way medical marijuana works is essentially trying to block the pain receptors on the nerves that send pain signals. So similar to the way that like a narcotic or an opioid would work, it blocks those receptors so that those signals just don't get sent. And similar to all medications, people can respond to it very differently. So some people get medical marijuana, which I also want to clarify. I think that a lot of people think that a medical marijuana card means that you go to a store and they hand you a rolled up piece of paper and say, go home and smoke this. There's actually a lot of different ways that you can get medical marijuana. You can get it in oils, you can get it in like edible tablets, you can get it in sprays, you can get it in topicals, so like a cream that you put on an area. It does not just mean that you're going on the back porch and lighting up a joint. But similar to a lot of medications out there, people respond to it very differently. So some people find that it does give them very effective control over their pain for prolonged periods of time if they're using it regularly. Some people feel that it's just effective for a little bit and then the pain comes back in. So it can sort of fit into either category of long-term management of giving your body a modality that helps it become less sensitive to nerve pain signals, or it can fit into the category of something you use temporarily to help get maybe your activity levels up or your sleep or nutrition under control. And then as that starts to get better, you don't need the medical marijuana as frequently. Does that answer the full question?
Yeah, I think so.
Okay, now what about CBD?
Okay, we have a follow-up question on CBD.
Was that the whole question? What about CBD?
It was that was the effective.
That's fine. I just wanted to make sure I didn't miss anything.
That was
so okay. So truthfully, I am not super well versed on the huge chemical differences between medical marijuana and CBD, other than CBD is just taking one small part of the chemical compound out of marijuana and it eliminates the more like hallucinogenic compound. So truthfully, I don't know the efficacy of one versus the other. The only thing that I know is that like the CBD at the gas station and the CBD that they sell like just at like Joe Schmo's store isn't always regulated. So if you go to the medical marijuana shop, it's going to be FDA approved. It is going to be 100% what they say it is and contain what it says. Anything that doesn't have an FDA stamp approval on it can really have anything inside of it, and it's not regulated. So CBD is probably pretty darn effective, but what you buy at Keats may not be entirely CBD.
It is, and you're right. It's not all created equal.
Yeah.
But it is just as effective as marijuana.
What was your condition of feet?
Yeah.
Did you say?
And
the term?
Tarsal tunnel, like carpal.
Okay.
Yeah.
But in your feet. Yeah.
Is that similar to neuropathy?
It is sort of, kind of. Yes.
Did she hear that? Doctor hear that?
Right.
Is I guess the question.
Little different. So yeah, neuropathy is usually, it can come from a couple different reasons. It can come from diabetes, it can come from your back, it can come from like a lack of blood supply to your nerves, whereas tarsal tunnel is very specific to the tendons, nerves, and blood vessels that travel on the inside of your ankle. So it's very localized to that area. And you can still get radiating pain into the foot, but the area of issue is just in the ankle, whereas neuropathy is a little bit more widespread. It means that nerves traveling either from your back or in an entire region are affected.
Okay. All right. Thank you. Yeah. We're hoping to have Dr. Shields back in the future for some more programs. So thank you. I think this was great. Yes.
All right. Thank you all for having me.
Thank you.
Thank you very much.
Nice. Good night. And for those of you at home, I'm going to include my email address in the chat. So if you want links to the event, which will go up early next week, or just a copy of the handout, I should be able to email that to you